In an ever-changing news cycle, we interrupt one special report to bring you another. Now we go to the governor's office in Lansing, where she is supposed to be giving an update on the COVID-19 response.
71% of our voting age population cast a ballot, and that's the largest number in 60 years. On this note, I want to thank our incredible Secretary of State, Jocelyn Benson, our Attorney General, Dana Nessel, who's worked incredibly hard on both of their teams, and all of the clerks across our state for their hard work for days and months preparing for this historic election, and of course the important duties of ensuring every vote gets counted. We're really pleased with how drama-free, relatively drama-free, this election was here in Michigan. I also think it's important to acknowledge the thousands of poll workers who worked around the clock to ensure that every vote was counted. They rolled up their sleeves and did the people's work, and we could not have had a successful count without their dedication to the democratic process. Democracy is a team sport, and here in Michigan, we worked hard to ensure that the outcome of the election was determined by the will of the people of our great state. And the people have spoken. And with the election behind us, now is the time for us to find common ground and come together. It's time for us both as a nation to come together and as a state to come together, because we still have a lot of work to do. We have a common enemy, and it is COVID-19. It is not one another. It is not our fellow Americans. It is certainly not our fellow Michiganders. This pandemic has ravaged our state, infecting more than 190,000 Michiganders and taking the lives of over 7,400 of us. We are continuing to see record numbers of COVID-19 cases and hospitalizations, and it continues to ramp up across the country. Yesterday, as a nation, we recorded 100,000 new cases in the United States. That's the first time we've ever reached a number that high in a single day. So fighting this virus needs to be a team sport, one that requires leaders from both sides of the aisle to work together to keep Michiganders safe. As governor, I remain ready to work with our state legislature on areas where we can find common ground so we can keep our state safe, keep our people safe, keep our economy engaged. I remain fully committed to doing everything we can to slow the spread of this deadly virus so we can protect the health and the safety of our families, our frontline workers, our seniors, and our small businesses. So let's take a look at where we are here in Michigan. This graph shows our cases per million lined up with actions that my administration has taken over the past 8 months. The furthest line to the right shows when the Supreme Court issued their ruling, striking down the law under which I issued executive orders to protect Michigan families. As you can see, our cases per million since then have been on the rise, dramatically so. The next slide, the graph shows the same timeline with Michigan's hospitalizations. And as you can see, those numbers are on the rise too. Hospitalizations are always a lagging indicator, but you can see what the trend is. We are not alone, and this graph gives us a little perspective. Other states are seeing a rise in cases and hospitalizations as well. But if we want to avoid looking like Wisconsin, which is the blue line there, we have got to take action now. This week I sent a letter to the Republican leaders in the legislature urging them to pass legislation that requires Michiganders to wear masks in indoor places and crowded outdoor areas. I want to be clear, this is the law under epidemic orders, but we do think that it would be helpful to our health, our safety, and our economy if it was codified in a bipartisan way with the legislature, and that's what we've asked for. We've known for a long time that the single most important weapon we have against this virus is a simple act of wearing a mask. Dr. Robert Redfield, President Trump's CDC director, recently wrote on Twitter that the best defense we currently have against this virus are the important mitigation efforts of wearing a mask, washing your hands, social distancing, and being very careful about crowds. Wearing a mask protects our families, it protects ourselves, it protects our frontline workers and our most vulnerable members of our society. It'll help us keep our schools open and allow our businesses to succeed. And at this moment, mask wearing could not be more critical. Our numbers are climbing, and we are now seeing new highs of daily confirmed cases every single day. Wearing a mask is the law in Michigan under the DHHS Director's Epidemic Order. But something this important, this critical to saving lives, deserves the legislature's stamp of approval. It will send a resounding message that every one of us has to do our part. The legislature has said time and time again they want to have a role, and if they really want to be a partner in fighting this virus, we invite them to take this step as the very first thing they do when they reconvene their session days. As Washington returns for their own lame duck session, I really hope to see a bipartisan bill passed to provide more relief during this time of COVID. Our numbers show that this pandemic is not gone. In fact, it is arguably at the worst numbers we've seen in this country. The president has said he wants to see a relief package, and it might be the one thing that we can all hopefully agree on. Families, frontline workers, small businesses, and communities across the country are awaiting much-needed action from the federal government. We need the president and Mitch McConnell to work across the aisle with Speaker Pelosi to pass a bipartisan relief package that includes more help for unemployed workers, more small business help for women and minority-owned businesses, and more money to safely reopen our schools. My administration is continuing to take action to protect Michigan workers as cases ramp up and we continue to fight this virus. No Michigander should be worried about catching this virus at work. From the beginning, I've worked to ensure that all the work that can be done remotely is being done remotely. Now we're strengthening those efforts to protect more Michiganders under the law. In an effort to prevent the spread of COVID-19 and protect workers, workplaces, and customers, MIOSHA is increasing scrutiny on the remote work policies established by the Michigan business community and primarily policies that revolve around offices. Next week, MIOSHA will announce a new state emphasis program for office work. The focus of this program is to educate and seek compliance with guidelines and rules where community spread of COVID-19 is a risk. Under statute, MIOSHA can cite employers, require abatement, and fine them up to $7,000 for failing to produce a remote work policy, or if the employer's preparedness and response plan is non-compliant. Under the emergency rules and orders, employers shall create a policy prohibiting in-person work for employees to the extent that their work activities can feasibly be completed remotely. So we have challenges that we need to come together around. There is good news here, and the good news is that we know what it's going to take to be successful. We know how to fight COVID. We have been through this, and we have done it successfully. Now is not the time to abandon all of these protocols or to drop our guard. It's actually time to double down on wearing your mask and safe physical distancing. It's time for Michiganders who haven't yet gotten their flu vaccine to go get it done. And we must work together to protect our families and our frontline workers who are exhausted, who have put themselves on the line and have done the incredible work to keep other people safe and exposing themselves to this deadly virus. We need to do it for them too, and for our small businesses. Michiganders are tough. We have grit. We take care of each other. And we can't stop now. We have a beautiful weekend ahead, and I hope that my fellow Michiganders will try to get outside and get some fresh air, to think about planning your holiday. What are you going to do to stay safe? How can you stay connected with your loved ones without all coming together and potentially exposing one another to COVID-19? As we head into Thanksgiving, I encourage you to follow the guidance from the Department of Health and Human Services. Get outside whenever possible. You have up to 20 times higher risk of getting sick inside. Wear your mask. Take it off when you eat or drink and then put it back on. Keep 6 feet apart as much as you can. Wash your hands regularly and try not to share utensils if you do come together for a small holiday gathering. We're going to get through this together, but we've got to take care of each other as we head into this winter. Thank you, and I will hand it over to Dr. Janae Caldoun.
Thank you, Governor. Good afternoon. So we are very concerned about what we are seeing across the state with COVID-19. As of yesterday, we had 192,000 cases, 96 cases, and 7,419 total deaths in the state. Our overall case rate is 261 cases per million people. We're seeing more than 5 times the number of new cases per day now than we saw in early September. The good news is testing is going very well, and we performed 43,000 diagnostic tests per day over the past week. However, the percent of those tests that are coming back positive is increasing and is now at 7.5%. That rate has been increasing for the past 5 weeks. Let me talk a little bit more about how the state looks regionally. The Upper Peninsula region has the highest case rate at 509 cases per million. That rate has been increasing for 9 weeks straight. The Grand Rapids and Kalamazoo regions have 370 and 331 cases per million, respectively, and both regions have the highest test positivity rate in the state at over 9%. The Detroit, Saginaw, Lansing, and Traverse City regions all have over 200 cases per million and between 5.5 and 7.7% positivity. The Jackson region now has our lowest case rate and lowest positivity rate as well at 193 cases per million and 4.1%. As the governor mentioned, hospitalizations are also going up in every region across the state. As of November 4th, more than 1,900 people were hospitalized for COVID-19 across the state. That's almost 4 times more than we saw at the end of August. We're not yet seeing the hospitalizations that we saw in the spring, but they are rapidly rising. Now, compared to the spring, about 60% of COVID hospitalizations are occurring outside of Southeast Michigan. We're working very closely with our hospital systems to understand their surge capacity plans and what they need to do to take care of both COVID-19 and non-COVID-19 patients. As has been the case throughout the pandemic, as hospitalizations go up, we expect deaths to follow within a few weeks. Our 7-day average for deaths is at 19, twice what it was at the beginning of September. We have models that estimate that at the rate we are going, if we don't do anything else, if we don't change our behaviors, we could be seeing up to 100 deaths a day by the end of December. We are really at a tipping point right now when it comes to COVID-19 in the state. Our rates are rising exponentially, and we have general community spread. This means that the cases we're seeing are not just associated with outbreaks. Many people, in fact, as many as 50% of positive cases that we investigate have no idea how they got the virus. Our local health departments are also investigating over 590 outbreaks across the state, the largest number since we began tracking these outbreaks. They're occurring in various settings, including long-term care, schools, manufacturing and construction, healthcare, and social gatherings. I want to give you a few more examples of what we're seeing with these outbreaks. There was a family that attended a birthday party, resulting in an outbreak of 6 cases. A wedding this fall resulted in 13 new COVID cases. We've seen outbreaks at recreational facilities. There was a high school sleepover, a high school banquet, and multiple outbreaks associated with both K through 12 and college sports teams. We have multiple outbreaks associated with funerals, and it's impacting workplaces. Example of workplace outbreaks include office buildings, assembly plants, manufacturing, and a grocery store. So this is important. Given the rates of spread that we're seeing across the state, employers that can have their employees work from home right now should be doing that. This means most office work, And for those companies that really must have their employees come to work, they should be making those workplaces as safe as possible and enforcing physical distancing and mask requirements. We're also actively working to prepare to distribute a COVID-19 vaccine when a safe and effective one becomes available. We are hopeful that one will become available this winter. It's important to note that when it first becomes available, it will only be available in limited quantities and will be prioritized to the highest risk people, such as healthcare workers and those living or working in long-term care facilities. MDHHS is already working with our healthcare systems, our local health departments, our pharmacists, and our community-based organizations to make sure people have access to the vaccine when it becomes available. It's important to note that a COVID vaccine is several months away from being widely available. And when it is, it will take months more for people to receive the vaccine such that it significantly decreases our infection rates across the country. That's why it's so important for everyone to continue doing their part. We cannot control very many things, but we can control our own behaviors, especially as we move into the holiday season. Please enjoy yourself, but be safe. It's safest not to have those large family gatherings this year. Remember to wear your mask every time you'll be within 6 feet of someone else. Wash your hands frequently, and please remember to get your flu shot. There's still plenty of time to do that. Things are concerning, but we are not helpless. If we use the public health tools that we have, we can get through this. And with that, I'll turn it back over to the governor.
Thank you, Dr. J. So considering where things are, we'll probably be doing press conferences a little more frequently as the numbers are very concerning. And on a high note, today is my daughter's birthday, so I didn't want to forget to acknowledge that. Okay, let's open it up.
All right, great. Governor, the first question will come from Tim Skubic.
Governor, you said the other day that your public health director does have under the pandemic or the epidemic authority to close down parts of the state. Based on your modeling meeting on Wednesday, do you see any parts of the states or counties that you think are in line to do that? And if so, how soon?
Well, at this juncture, I mean, the numbers that Dr. J just shared are very alarming. And I think that something that really stuck with me as we covered it was that she acknowledged there's a model that shows if this trend continues, we could be losing 100 people a day around Christmas here in Michigan. That's a devastating thought, and that's why we are really urging people to double down on the protocols we know that will keep us safe, and to have a plan going into the holidays where we don't bring many generations who don't live together. That is the exact kind of moment where we're worried that we will see additional spread. So we are continuing to monitor and pay close attention to the numbers. I think that it's at this juncture we're not announcing a change, and the Department of Health and Human Services isn't announcing anything today, but we're very concerned about what is happening and looking for ways, if there are, that we can address spread that is happening in certain parts of our lives. And I don't know that I have much more to add on that, Dr. J. That's about it.
All right, great. Governor, the next question will come from Jordan with Gonwer.
Hi, Governor. You touched on this a little bit in your remarks, but have you had any conversations with legislative leaders on the state's COVID response? And outside of the mask use in certain areas of the state, do you have any specific requests from them that you would like to see?
Well, I have actually invited some of the legislative leaders to participate in some of the update calls that we have. We had one last night that Tim just referred to, and we did have legislators on that call, members of both parties in both chambers. I think it's important, now that the Supreme Court has kind of muddied the waters and created a lot of confusion about what is the current law here in Michigan. I'd love to see us codify a mask order. I think that it's really important for people to see that we got to get the politics out of this simple act of masking up. I'm hopeful that it's not just that the die has been cast and we can never get back to a place where we focus on the public health and not worry about the politics. This remains the best implement that we have to keep spread down. I would welcome codification. The legislature has codified a lot of my other executive orders, and I'm glad for that. But I think that this is the most important one, and I'm hopeful that they will consider doing that and embracing and promoting masking as a bipartisan effort across the state. Because the fewer people that do this, the more likely we're going to see uncontrolled spread and economic impacts, and most importantly, devastating personal impacts in our health.
Governor, the next question comes from Dave with the Detroit Free Press.
Hi, Governor. Your administration has issued orders, obviously through the health department, but as you know, case rates are going up really high. Why do you think people are ignoring these orders, and what do you think it'll take for people to start following orders and for these case rates to actually start coming down?
Well, I think this is a theory. You're asking me what my theory of what's happening is. But part of the theory is that people are tired. We're all tired of wearing masks. We are all tired of dealing with COVID, and yet ignoring the problem is making it worse. We have to acknowledge COVID is a reality, and the most important thing that we can do to get COVID out of our lives, or to at least get it under manageable number where we can continue to safely engage in other aspects of our lives, is to wear a mask. And so I think fatigue is a part of it. I think the political rhetoric has created a lot of confusion and unnecessary suspicion around the efficacy of masks. Every study has shown this remains the best tool that we have. And so I think that there are a number of factors here. But here's the deal. It's not an order that comes from a governor. It's not a Supreme Court decision. Every one of us has a role here, and every one of us needs to live up to that role. It's about our personal safety. It's about our personal families, but it's also about our economy that we all rely on. It's about our jobs. It's about our ability to do some things that are normal, to be able to visit with one another. All of these things are in jeopardy when people don't wear masks, and that's why I'm asking legislative leaders to embrace this. I am grateful that so many in the business community have, and encouraging them to continue. We've got a lot of doctors and nurses who are trying to encourage greater mask wearing. We all got to be in this one together. It can't just be some of us. It's really got to be all of us, and we're just trying to get the great people of Michigan to grit our teeth and do what needs to be done. We have done it before. We can do this. We rise to this challenge. We're all better off.
All right, we'll take a few more questions, and the next one will come from Jacob with Mars.
Hey, Governor. Question for you. The CDC came out with a national survey on mask wearing, and they found that about 89% of adults wear masks. Do you think that's got at least a ballpark figure for how many people in Michigan wear masks? And second question is, if a legislative mask law is passed, would more people wear masks?
So I can't tell you precisely how many adults in Michigan are wearing the mask. I assume the CDC, study is based on data that they've collected. I can tell you this. Anecdotally, I've heard from a lot of Michigan employers who have presence in other states. They say Michigan's compliance is better than any other state that they do business in. That's anecdotal. I don't have a study to cite. I don't have specific numbers. But I do think that we have a stronger culture around masking than a lot of our neighboring states do. I do believe that bipartisan embracing of masking up would significantly improve compliance. I think that the politics of masks has gotten in the way of us really, I think, all stepping up to this challenge. And so I welcome bipartisan support on this front. The legislature, I'd love it if they would pass a law. That's their job as to legislate. They can debate exactly what that law looks like. But I do think that it would send a powerful message about the seriousness of this moment. the need for us all to rise to the challenge, and the support for our economy and businesses to stay engaged, because we all are doing our part.
All right, the next question will come from Emily with MLive.
Sorry. Thanks, Governor. You say we know what works to stop the spread. A key part of that mix this spring was your stay-at-home order. Will you be asking MDHHS or the legislature to put another one in place?
So, Emily, back in the spring, I think it's important to kind of refresh our recollection, right? Back in the spring, we had uncontrolled community spread. We did not know how powerful just the simple act of masking would be in order to push our COVID numbers down. We were running out of PPE. Our hospitals had a shift worth of PPE one of those early weekends when we couldn't get the simple N95 masks for our doctors and nurses and first responders. We, of course, have come a long way on all of those fronts. We have better therapeutics now, too. All of that being said, it does appear that Michiganders have started to let their guard slip. Whether it is attending a gathering that you know is inherently dangerous, just the act of gathering with people from different households, whether it is not wearing our mask when we're having some small groups getting together. You know, every one of us has to really kind of reinvigorate our commitment to staying safe and to keeping our loved ones safe. As I prepare for the holidays, you know, I'm the kind of person, I love to have a big holiday dinner. Thanksgiving's my favorite holiday. Watch football on Thanksgiving, gather everyone around. I'm not going to do that this year, and I discourage anyone from doing that this year. We just have to be smart and get through this holiday season. And it's going to be a challenge, but I think that where we were in the spring versus where we are now, a lot of the fundamentals that really necessitated the immediate stay-home order are different. It doesn't mean that if our numbers keep climbing, we won't have to do some additional aggressive actions. But I do think those factors are really important pieces to the difference of where we are now versus where we were then.
All right, we'll take just a couple more, and so the next one will come from Rod with TV4.
Hi, Governor. Apologies, my button was stuck. Just curious, you just mentioned the holidays. Are you at all looking at or eyeing the notion of an order surrounding the holidays that would prevent people from coming together for the holidays, as you just suggested?
You know, Rod, I can't speak to that. You know, the orders will be coming from the Department of Health and Human Services. We have not had a conversation around that. I can tell you this, though. It shouldn't take an order of any kind for people to acknowledge that this virus could uniquely harm your loved ones if you pull people together and gather indoors with people from different households for any prolonged period of time without masks on. That's just the facts of this virus. So an order isn't going to change whether or not you're conducting yourself that way. It's going to be an individual decision, and we may have to take actions to heighten awareness about that, but the fact of the matter is, none of us wants to pull our family together and have it be a deadly outcome for someone in our extended family. And that's what we should all be worried about, because that is the very real threat here.
All right, and the last question will come from Matt with TV6.
Thank you, Governor, and good afternoon. Earlier, you talked about sending a letter to Republican legislative leaders urging them to push for mask wearing in indoor public spaces and outdoor crowded gatherings. What do you want the legislature to do that the state health department isn't doing already?
I'm happy to answer this one again. So, we do have a mask mandate in Michigan. It stems from the epidemic orders of our Department of Health and Human Services, and it has the force of law. And I want to reiterate that because I think it's important for people to know, just because the Supreme Court did what they did doesn't mean that it's changed the seriousness of this virus, the prevalence of this virus, or the fact of the matter that when you go to the grocery store or anywhere else, you need to be wearing your mask for your own protection, the protection of your family, and the protection of everyone you come into contact with. It's really important. And that's why I do think that codification, while it might not change the fact that this is the law, it will reinforce that we're all in this together. We have to get the politics out of this public health crisis. It is killing us. It is jeopardizing our economy. It is threatening our health systems that we all rely on. And that's why I am seeking legislative support, bipartisan support for masking up here in Michigan, because this remains, even with the therapeutics that are improving, even with the vaccines that look like they could be coming online in the next months. Today, the most important tool that we have is this mask. And every one of us has an interest in masking up. And if I can get support and we can grow the coalition to encourage people to do just that, it will save lives and it will mitigate the economic harm we're all confronting.
Okay, great. Thank you, Governor. Thank you, everybody.
Thank you.
You have been listening to Governor Whitmer give an update on the COVID-19 response here in the state, where she once again has reiterated that we should be doubling down on wearing masks. She asked the legislature to pass legislation that would mandate just that. She also said that Myosha would be looking into remote work rules, something that she didn't expand on, but said there'd be more information on next week. Earlier, you also heard a special report from NBC News as we try to continue to keep you updated on the progress of the election of 2020. We'll have much more on both of these tonight on News 8 at 5.